Health Check is presented by
Island Cancer Center.
It is estimated that about 20,000 individuals have hemophilia in the United States. Hemophilia is an inherited bleeding disorder that affects mostly males and occurs when the proteins or clotting factors that make the blood clot do not work as they should. The lack of clotting factor causes people with hemophilia to bleed for longer periods of time than people whose blood factor levels are normal or working properly. Department of Public Health and Social Services Medical Social Services Social Worker 3, Diana Santos.
We do have a total of 57 active patients that but of the 57 we have 13 who are hemophilia carriers, and what that means is that they carry the gene to further the disease, through their offspring. And then for hemophilia patients we have a total of 27, and the most common is hemophilia A disorder, where they're lacking factor 8, clotting factor.
For years on island, the private sector's health insurance plans did not include coverage of the blood or blood derivatives needed by hemophilia patients, leaving them to pay a significant cost for the hemophilia treatments or forcing them to quit their jobs so they could apply for government assistance programs such as MIP or Medicaid. It wasn't until the passing of Public Law 32-235 in January that relief finally could be sought by hemophilia patients. Medical Social Services Rose Zambala.
For government of Guam employees, that was covered since 1998, but we continued the fight to have this new law to cover blood and blood products for private insurance.
The law now mandates that health insurance offered by private companies cover blood and blood derivatives. This Friday, March 13th, at the Westin Resort and Spa, in celebration of Hemophilia Awareness Month, a conference will be held to discuss the implications and impacts of the law.
What it means for our family is that now they can live comfortably and be assured that they can lead normal life, and instead of just depending on being on Medicaid and MIP. Some of our families actually had to rely on the Medicaid MIP. Sometimes they forego having overtime pay for fear that they may go over the income criteria for Medicaid and MIP.
Zambala says that now, knowing that the private insurance will cover the blood and blood derivatives, hemophilia patients can now work without the fear of losing their insurance. With this week's Health Check report, I'm Jolene Toves.
Health Check is presented by
Island Cancer Center.